We now turn to Professor Fan Xianqun, academician of the Chinese Academy of Engineering and Dean of the Shanghai Jiao Tong University School of Medicine. His topic is Strategy for Retinoblastoma Treatment in China. A warm welcome for Professor Fan Xianqun.
Okay, thank you very much. Okay. Good morning, teachers and colleagues. I would like to express my gratitude to Denson Lim for creating this good opportunity. And it's my great honor to share my team's work about retinoblastoma. Okay, retinoblastoma is a malignant ocular tumor can lead to the blindness, disability, and death. And it has been classified as one of the top 10 severe childhood disease requiring treatment. And the treatment objects are to prevent the life, saving the children's life, and protect the eye and protect the visual function. Okay. RB is a genetic defection disease caused by mutated RB1 gene, and RB1 transcript is 4.7 kb. RB1 is the first tumor suppressor genes and with 1,700 mutations. Classical pathway involve the development of RB is CDK E2F signaling pathway, which regulated cell cycles. And in some patients, RB1 gene mutations are absent, and MYC MYC gene activation is abnormal. Okay, the third origin of retinoblastoma is debated, with hypotheses suggesting origins from the retinal progenitor cells, Mueller glial cells, and Cohen cells. Most researchers now believe that the tumor originates from Cohen precursor cells. Okay, in our study, we use a single cell sequencing to reveal the cell region of RB and found that 6 of 10 patients identified subpopulations in retinoblastoma are derived from Cohen precursor cells. Okay, we have also established two rare subtypes of the RB. You can see the late onset retinoblastoma and cavitary retinoblastoma. Okay, besides, we found that there is no unique genetic background in China RB patients, but approximately 32% of the patient has no RB1 mutations of copy number variation in China. I don't know the cause. Okay, we also have demonstrated that the chromosome conformation, RNA modification, and histomodification play an important role in the carcinogenesis and progression of the RB. Okay, this slide shows the history, the treatment of treatment on RB. Okay, today I introduce my clinical work in 3 parts, and firstly, retrospective cohort study. Okay, to understand the status quo of the RB in China, we conducted a multi-center respective study and investigate 2,552 patients and RB patients from 38 centers across China. The most common complaints were leukocoria and strabismus. About 6% were detected by screening in China. The majority of the RB patients in China was at stage D and E. accounting about the 72% of the total. Okay, the overall survival rate is 87% in China. And for bilateral retinoblastoma with the first eye classified as group B patient undergoing primary enucleation inhibited between overall survival. And second, we introduced carry out the intra-arterial therapy, chemotherapy. Okay, VEG regimen of IVC are used in RB for decades, but it has high side effect and recurrence rate. Vitreous cavity chemotherapy is suitable for the vitreous cavity implanted RB, but it has poor effect on subretinal tumor. How to reduce the eyeball remove rate and the side effect? So this slide shows us the sub-selected intraarterial chemotherapy. We can see we choose the carry out ICA intubate through femoral artery DSA imaging and ophthalmic arterial injection. This slide shows us the order to solve the problem of IC in children under 3 months old. We adopted the technique of the retinal carotid artery, carotid arterial balloon occlusions. And according to our cohort study for ophthalmic arterial occlusions, there are 2 main risk factors, more than 3 times of IAC, and the diameter of the ophthalmic artery less than 0.65 millimeters. A patient with these risk factors should be treated with balloon conclusion technique. Okay, like in this picture, we can see in order to solve the problem of the ocular artery alterations, we performed bypass intubation technique for external carotid arterial through meningeal artery to ophthalmic arterioles. Okay, the successful rate of the intubation was increased to 98% by ocular artery intervention, bypass, and balloon systems, and the eye preservation rate increased to 8% for patients in group D and about 30% for group E, RB. Next, we carried out the multi-center RCT study. Okay, since there's no consensus about the pros and cons of IVC and IAC, we carried out an RCT study on RB to compare the effectiveness and the safety of IAC with IVC. This is the multi-center RCT for advanced intraocular RB. This is a study protocol, and the primary outcome is a 2 years progression-free global salvage rate. And the primary outcome, a total of the 143 patients were enrolled and randomly assigned to IAC and IVC group. The 2 years progression-free ocular salvage rate was 52% in IAC group and 23% in IVC group. There is no significant difference in overall survival rate between IAC group and IVC group, and objective response rate in IAC group and with difference with the IVC group. The relapse rate of 2 groups has no difference. Okay, the IAC reduced the incidence of the bone marrow suppression from 70% in IVC group to 50%, and the severity significant decreased. Okay, is a research published in the recent Children and Adolescent Health. And based on the previous study, and we try to reduce the local complication of IC, so we propose the 2+2 combined chemotherapy plan and carrying out the RCT study to verify the efficacy and safety of the combined chemotherapy in advanced RB. Okay, thank you very much. And our work was supported by several national and local research fundings. And special thanks to my team's members and cooperative partner. Thank you very much. Thank you.